Hi, well, it's day 5 after my prostatectomy surgery. Thought I'd check in and give everybody a brief update on how I'm doing, feeling, some of the experiences I've had so far after my surgery. We'll talk about pain and pain meds. So, my pain has been pretty tolerable since I've gotten home. The doctor did give us 5 different pain options. One was Tylenol. It's supposed to last about 4 hours. The second one was a pain pill that lasts about 6 hours. The third one would be a narcotic, of course, for extreme pain. To be honest, I haven't taken that at all. I know they gave me the narcotic back at the hospital, but I'm not a big fan of taking narcotics, and so haven't had to deal with that. The last pain medication was one for the catheter, and essentially the way that we understand it is that it's supposed to relax kind of the muscles around the penis and the bladder itself, lessening the sensation and therefore decreasing some of the sensitivity and pain that might be associated with that. Overall, the Tuesday and Wednesday, I did have to use the one for the catheter and that second one mixed with Tylenol. Thursday, took very little pain meds, took some Tylenol. Friday, Tylenol, and today is Saturday. And took some Tylenol today, mainly just to kind of help with some of the sensitivity that is associated with moving around. We have a 2-story home, so going up and down the stairs, things like that. We'll talk about discharge. So, one of the things I've noticed is with the catheter, I do have some discharge. It's a little hard to describe, but basically it's kind of a clear liquid mixed with some blood. Um, and what happens is that it will discharge and then it'll get stuck on the tube that is coming outside of the penis. And when that happens, as I'm moving around, the tube moves around and inevitably tries to sometimes go back inside. Not very much, but just enough to make it extremely sensitive. What my wife and I found that really works well for me is about 3 times a day we will take and clean the area and clean off all the blood. The blood gets really sticky sometimes on the tube, and then we go and use some Neosporin, and I put a good amount of Neosporin back around the tube and the tip, and that really seems to help, and then I can kind of move around again without it being so sensitive. Large bag versus the leg bag. So when they sent me home, they gave us the option of having, or they put the leg bag and used a strap on my leg for the urine to discharge into. What I found with the leg bag is, like others have said, they said it's real convenient because you can walk around and not have to carry something, but you do have to empty it about every couple hours. What I've opted to do and what I found is really nice is just to go with the large bag. And what we've done is we've gotten me a little bucket. I'll see if I can show it to you here really quick. There's my bucket. Okay, so that's my bucket. And basically everywhere I go, the bucket goes. Can be set down beside my bed at night. It's really convenient. As I walk around, sometimes I'll take the bag out of the bucket, but other times, like when I'm shooting this video right now, the bucket stays right beside me, and it works really well. Also, I don't have to dump the urine quite as often. Usually about maybe somewhere between every 3 to 5 hours, give or take, depending on how much I'm drinking, is how often it has to be dumped. So that's my experience with it. They are supposed to remove my Foley catheter next Tuesday. Today is Saturday. And so I'll obviously wear the leg brace with some sweats on my way to get it removed. Another element of sensitivity, and you may have picked up on it when I was trying to clear my throat, is coughing. Um, so the day of the surgery, which was a Monday, that Tuesday, and a little bit on Wednesday, I had a lot of phlegm. And we don't really know if it was from the tube being down my throat during the surgery or what it was. But anytime I went to try to clear my throat or cough, it was a little painful. One of the things that the nurse said to try was to put a pillow over my stomach and hold it next to me, which was a little awkward. But when we came home, my wife has this smaller heart pillow, and I tried that and it worked really well. So essentially, what I would do is if I need to sneeze or if you need to cough or something like that, and the pain's really bothering you, you just take it and put it over your stomach, hold it with your hands while you're, going through the coughing or sneezing or whatever. And believe it or not, it actually helps. And it was definitely enabled me to help get my throat a little bit clearer. I will say though, with the tightness and the bloating that is there, um, the first few days it was hard. It was a little more difficult to kind of carry on a conversation for me. I just found myself getting a little bit more winded, and I think it was because of all the pressure that was there. Today, as I'm doing this video, it hasn't really been quite as bad. My diet. So my wife has made some homemade soup. She's been just great. I've been calling her my wife nurse. It's just awesome. I do, as I mentioned, live in a two-story home, so going up and down the stairs hasn't been something I've been doing a lot of. Today is beautiful outside, so obviously I'm shooting this outside. But she's been making a lot of homemade soups. I've had some homemade chicken noodle soup and some other soups. I can't remember their names, but they're really yummy, really good. And then she would, I had a sandwich today. Friday we had some fish, and salads. She's been trying to ensure that the foods I have some fiber in them, so that it'll help with bowel movements. So bowel movements. My surgery was on a Monday, and my last bowel movement was on a Saturday before. So I didn't have my first BM until Wednesday, and it was an interesting experience for me. One of the things that they tell you early on is that when you go to have your bowel movement, to not bear down. And it's kind of almost an oxymoron, because as you know, when you go to have a bowel movement, there is an element that, or at least in my case, of needing to bear down. But I found that maybe like 30% to 50% less than what I would normally do was sufficient enough to have a bowel movement. But the tube, so initially when I went to, sit down to have my first bowel movement, I realized that the way the tube is attached to my leg, it's on a patch, it's got a little clip on it. It didn't work real well for me, but I found that if I unclip the tube, that it gives the tube a lot of flexibility, so that way when I'm sitting down on the toilet, I can move the tube where it needs to, so it's less sensitive, and I can go through the course of having my bowel movement. So I hope that helps if you come across that. I know that was a real interesting thing for me. The scars and the bloating. So as I mentioned previously, I was really bloated, really bad. It was really big. But let me see if I can show you my scars today. All right, so those are my scars, my bowel wounds. The big one that you saw right above my stomach, or my belly button, that's the one where they inserted the camera. That's the one where they brought out the prostate. The other ones were the different types of instruments that they had to insert inside me to do all of the work. You may have seen it, may not have seen it. I am still somewhat bloated, not near as much as I was though early on. So the sensitivity, it's still there. There's a lot of tightness when I stand up, or quite a bit of tightness, not as much as there was early on. And the pain, it's still sensitive. It's kind of like more of a soreness though than it really is a pain. Like I said, it's something I'm able to manage with Tylenol. But again, I think that kind of covers everything today. I am trying to get up and walk more. As you can see, I'm trying to get outside today. We live here in North Texas, so we had a storm that came through on Friday, so it's made it a beautiful day outside. And overall, I feel like I'm doing fairly well. So I hope this video helps, and have a great day. Bye.